Welcome to The Better Life with Dr. Mary Ann Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information,
and
can
so
lead
honored
you
to
to
be
the
on
better life.
and sharing
now, here's
some time
your host,
with you.
Dr.
I have
Mary
such
Ann
a passion
Pinkston.
and a love for combining more holistic and contemporary medicine together. And we call that integrative medicine or functional medicine. And I do believe it is a definite, more compassionate way of attending to patients and taking care of their needs. And so I get the lucky day of spending some time alone. So usually I have some guests, and I've really enjoyed that. I've had some great people on, but today I get to do this by myself. And I love this opportunity because I get to explain some of the problems and issues that patients have that normally you don't get a full 20 to 30 minutes with your doctor for them to explain a condition and explain it well enough for you to truly understand what's going on with your body. And one of the highest topics that I get asked about and I check and talk about at the clinic is thyroid disorders. So we're going to talk thyroid a little bit today. And thyroid is a very interesting topic in many ways, but one of the biggest reasons is because most patients come to me and say, either I'm very exhausted and tired, I think it's my thyroid, or I'm not able to lose weight, I think it's my thyroid. And what most patients don't understand is that thyroid has a lot of power in your body, but it doesn't have that much power normally to control a whole set of symptoms and circumstances that you're, going through. So thyroid in combination with other things, that's why I do more hormonal treatment and I add, vitamin and mineral supplementation combined with lowering inflammation in your body, helping you clean up your diet, things like that. And then thyroid pops in there, and that is part of the whole plan, and it is greatly affected by your stress and by your adrenal glands, and that is your adrenal glands pump out that cortisol, which is something that can ruin everything from your waistline to your thyroid function and anything else, your sleep, for instance. But the thyroid is, and if you look at, fatigue and losing weight, it's like a big puzzle. So you have to fill in all of the pieces of the puzzle in order to improve something and make something better, have your body at its highest functioning status. You have to fill in all of those pieces. And thyroid is just one of the pieces. So I really want to hammer home today that, thyroid is very important, but it's not the total deal. But in its importance, what does it do? So, first of all, it's a gland that sits at the base of your neck. And it's, very forward in the neck. So if you develop inflammation or nodules, they can be seen normally very easily. So if you feel like the bottom of your neck is puffy, that might be your thyroid gland and it might be inflamed. And with the thyroid gland, then what does it do? It runs your metabolism. So it's not the total deal, as I explained, but it is part of the metabolism of your body and your body temperature. That's why people with thyroid disorders, you're either too hot or too cold, and everybody else is the opposite. It also helps to keep your hair growth and your nail growth and your skin texture soft and supple, and your hair replaces itself well and grows very strong and more quickly. It also has to do with your bowel movements. So if you are constipated, that could be an issue. Thyroid could be underlying that, and so many more things. And I think fatigue and energy is the last thing that most people will talk to me about besides weight loss. And the fatigue that comes from thyroid is devastating in some cases. So, when you're the lucky one, so to speak, if you are one of those that just have a thyroid problem, well, then that's very correctable and very, very common actually too. So thyroid disorders aren't necessarily genetic. And most patients will come to me and say, well, my mom and my grandma had it and my sister, and so I figure I have it. And thyroid disorders aren't truly genetic at their base, but extremely common. And there are lots of external factors that can affect your thyroid. So there's two types of thyroid diseases. And I'm going to stick with hypothyroidism, which means your thyroid is too low. So in hypothyroidism, in my mind, there's two basic ones. And of course, this is much larger subject and more complex, but I'm going to kind of keep it at the most common issues. And the two issues are that your thyroid just doesn't make thyroid hormone. And I'm going to set that aside for the moment because that's easy. We just give you thyroid hormone. On the other end, though, is a more secondary cause. And what your thyroid does when it puts out thyroid hormone, you imagine it circulates throughout your body and does its job, controls all of those factors of fatigue and metabolism and all those things. But actually, thyroid hormone, when it comes out of the gland, doesn't really have a function. It goes to your liver and some other tissues, even the retina of your eye, and it gets converted. So you take thyroid hormone, which is T4 coming from the gland, and it gets converted in mainly the liver to free T3. Again, I know it's more complicated than this for those of you who are very astute in this or listening, but it gets converted. So if you are converting your T4 to T3 very efficiently, then you don't have a thyroid problem. But let's say you're not converting it. Why would you not convert it? Most of the time, I would say the number one reason would be cortisol or your adrenal glands or your stress hormone. So when you're under intense stress, and it's not just a daily simple stressor, it is years, months and years of stress that compounds it, and your adrenal glands are on fire and running your body entirely. It interrupts that function of conversion from T4 to T3. Other things, there are mineral and vitamin deficiencies that also do the same. So if you are low on selenium, iodine, and we're going to talk about iodine in a minute, but low on selenium, iodine, some B vitamins, zinc, those are ones that can also, when you're deficient, decrease your ability to convert from T4 to T3. So if you're not converting T4 to T3, how do you feel? Well, that's when it happens. So you're fatigued, unable to lose your weight efficiently. Skin and skin becomes very dry. Hair and nails become very dry. But then again, you also can't grow your hair very well. I'll share a story with you that under intense stress over the last years, I have had a thyroid deficiency. And it became so terrible, honestly, that I lost all of my hair and lost my eyelashes and the outer thirds of my eyebrows. So if you look in the mirror and you're like, why aren't the eyebrows, half of my eyebrows aren't growing in, that's an underlying thyroid problem. And so in losing all of that, had to learn all this, get my thyroid going again and use thyroid medication. Again, we'll talk about in a few minutes, but mainly I needed to control my stress. I think, I take a lot of great vitamins and supplements, but again, I think stress is such a huge factor. So in losing all of that and feeling terrible, gained quite a bit of weight and was able to correct it. And the way that I do that amongst, trying to get you to control your stress, I need a whole show to tell you how to do that, but to control your stress. And there's supplementation that you can do to help that. Supplementation that can include selenium and zinc and vitamin C and some of those other things. And I also use a CBD product. Now, this is something I've talked about on a previous show. Go back and look at it. A CBD called Swish that is available through me, and I invite anybody to take a look. I'm not a big salesman in this department because I don't think that I could make a huge living off of it necessarily. There are people who do, but I offer this as a product to folks that would like to improve sleep and their stress. But there's a Facebook community called Cili, C-I-L-I Lifestyle. And the photos of hair growth and nail growth and, the improvement in energy and anxiety and things like that are amazing. So there are tons of products that, patients can use to try to help besides just taking a thyroid medication. But if you need to take thyroid medication, let me explain this, because most patients, when they come and say, I'm on thyroid medication, they're on Synthroid or Levothyroxine. There are others, but those are the two most common. Synthroid and Levothyroxine is just a T4 product. So T4 is something, again, that if you don't have in your body, you do need to replace. But once you replace it, then it has to convert. And if it's not converting, you can still be hypothyroid and still have all of the symptoms. So I use a more natural, and a lot of patients are very, very, resistant to taking thyroid medications and pharmaceuticals, want to do things naturally. Well, when we use some of these more natural medications, they are still prescription, but they are from a natural source, an animal source. So when I give this medication, it is a T4, T3 combination. You may have heard of them. NP thyroid, Armour thyroid. Nature thyroid used to be a wonderful one. It's now off the market, but the other two are probably the most common. Liothianine, Cytomel, those are more the prescription-based ones. There's slow release formulas. There's so many different ones. I have the most luck with the animal-based natural ones. And they're not expensive. You can go to GoodRx. If you have the app for GoodRx, that now it's a little white box with a yellow cross to it. And it's just GOOD and then R with the X through the end of the R there. So GoodRx has a great program for NP thyroid where it's $10 a month for the most part. It changes from time to time, but that's very, very easy for people to afford if your insurance doesn't cover it. So I give you this T4 and T3 product, and both together, if you give more T4, it actually pushes your body to convert better and make more T3 on your own. So we really are trying to get your body to work its normal fashion. It is a natural substance, and it has a very natural and wonderful effect. Now, 1 or 2 patients a month, maybe a little less than that, will come back to me and say, okay, I started taking the thyroid and now I feel worse. My heart palpitates, feel more tired, my energy's completely gone. And there is a reason for that. And most patients will say, well, when I got on the medication is when I got worse, so I don't want the medication. And they'll just stop their meds. They won't call me and let me know that this is occurring. So it's very frustrating for the patient and for me. So I want patients to understand that if I give you this medication, you feel worse, you need to come talk to your doctor. You need to come explain these things. I know how to guide you through that. Your body can shut down in ways and, shunt the conversion, and there's all sorts of reasons for that against very, very large subject. But there are ways that patients can feel worse on their medication, and it's very fixable. I just need to know about it. So don't just stop your medication, any of your medications, unless you consult with your doctor. Come talk to me about it, and I'll be happy to fix and arrange that for you. So, we've covered some of the basis of, where is your thyroid gland? What does it do? The different types and, what we do to make you feel better. And I think if, patients can understand that we do combine this as a whole. So I do a lot of hormone replacement for testosterone and estrogen. Yes, testosterone is good for patients, both men and women. Men need to be 900 to 1200. Women need to be 250 to 350. So it's a distinct difference. But we need both of those hormones. Even men need estrogen as well. And what it does is it just helps to increase your body's ability to, function at a normal status. And all of these things that I've talked about, even though thyroid is a prescription, they're still all natural, ways of treating your body. Cortisol, again, is something that, if you are living a high stress life, working overnight, you're not able to get normal hours of normal sleep, which high cortisol levels will interrupt your sleep, but which came first, the chicken or the egg? But if you're not able to, straighten up your cortisol, then we are going to have a very difficult time with your thyroid and that conversion. So that is another reason why patients can sometimes feel worse when they start the medication. So again, just get in and talk with me. We can check. I do laboratory at the office. And the laboratory that I do is very different than a lot of physicians. A lot of physicians will check a TSH and a T4 or just a TSH or just a T4, and they're missing half of the battle there. So free T3 is something that truly needs to be added. Cortisol levels, that's an interesting topic as well that we need to cover. But you can check those values and see if you're, where you are in the status of things. If your TSH and your T4 are normal, then you are not going to be diagnosed with that secondary version of hypothyroidism. You absolutely have to check the free T3 as well. I'm going to talk about reverse T3 in just a few minutes. But I'm going to take a moment just to let people know kind of where I am and what I do. I am at Shanefield Road off of 1604, so 10865 Shanefield Road, Suite 1101. The office phone number is 210-698-7825. I'll repeat that, 210-698-7825. And for the most part, you can find all of my information about where to find me in clinic or where to find the show. If you like, things like podcasts and YouTube, I'm on there too. So go to drpbetterlife.com, and I will have a lot of information for you about thyroid and conversion, about the CBD product, about certain vitamins that you can use to treat your cortisol. And you can find those things and purchase them through a wholesale dispensary that I have joined, not to make money, but just to ensure that patients get a great product that's not third party from Amazon or someplace. Nothing against Amazon. They do a great job, but a lot of times it's the people who are selling on Amazon that concern me. They'll empty out a bottle of something, replace it with something else, or add something that has a lot of fillers and sell it for twice the price. So you really want to be careful about that. So join me over on the other side. I'm going to talk a little bit about thyroid medication again and about reverse T3 and see if we can't get you guys feeling better. Hi, welcome back. I am talking about one of the most popular topics that occurs in my clinic. One of the biggest complaints that I get is my thyroid is off, or I think my thyroid is off. And it is a big topic, let me tell you. I have this talk about, 10 times a day, probably 5 days a week. About thyroid disorders. So I wanted to give you guys a little bit of insight into, how it's diagnosed and how I do it a little bit differently. I'm going to say really quickly, though, for information on the podcast here, I'm not just on local radio, but I am podcasted to iTunes and Spotify and Amazon Audibles and all of those places. And you can find me at drpbetterlife.com. That's drpbetterlife.com. And I'll have some links for you to look at as far as some of the topics that I have, but also thyroid conditions, medication, and some of the supplements. So in returning, I wanted to talk a little bit more about thyroid medication and reverse T3. So with thyroid medication, when patients get Synthroid and Levothyroxine, I'm going to stay with T4 for just a second here. What concerns me is the FDA years ago said that generic medications can be made of some of the medications that carry a patent and are so expensive, and then after 10 or so years they can become a generic. Generics, though, have a leeway. They have a leeway of about 30% on the dosage that is contained in the product. So if you're taking a blood pressure medication that's 300 milligrams, well, 30% might not make a huge difference in the dosage. When you look at thyroid medications, 30% is huge because thyroid comes in micrograms, not milligrams. So it's a much, much tinier dose. And with thyroid, you have to be very, very accurate on your dosing. So when you take a generic product, a generic thyroid, it may be 30% off of the dosage of micrograms, therefore leaving you to chase your thyroid disorder. Sometimes you feel good, sometimes you don't. Now, 30% you're assuming is underdosed. It can be over as well, and that's a very dangerous thing. So we really have to be careful when we prescribe. That's why if I use T4, which I don't very often, but when I use T4, I don't use levothyroxine or any generics. I stay with Synthroid because that is known to be on the spot dosing and equal the micrograms that it should be, and they're very calculated about doing that. So also the same in the area of the T3 products, the T4, T3 products like NP Armor. That's why I like NP as well so much, because there's no discrepancies there. So always before you leave the pharmacy, if I prescribe these medications, I put name brand necessary, and but sometimes they still get switched. So before you leave the pharmacy, please check your bottle and make sure that it is the name brand, exactly what I'm prescribing. And because once you leave the pharmacy, there's nothing they can do about it. If your insurance is paid for it, well, then you're stuck, and you're going to have to use that for a month, and that may, mess up all of what we are trying to do with getting your thyroid straightened out. Onto now reverse T3. So reverse T3 is very interesting. And I want to keep it short. You know, this 7 minutes that I have tacked on at the end is so short. But reverse T3, in a sense, does that. It interferes with your thyroid's ability to fully function. And it is based on parts of your cell called the mitochondria. So when the mitochondria produces it, it actually will sit in the space on your cells, the receptors where T3 is supposed to sit and have its action. Reverse T3 will sit in there and it's stubborn. It won't come out and it will take up that space, but it has no action. So you could have a normal free T3 but still not feel well and have those low thyroid symptoms. And there you go. It's because your reverse T3 is too high. And that is strictly something that is nutritional, stress related also. Stress is involved in everything, so you can just almost count on it. But reverse T3 is something that should be checked and included on your laboratory as well. So again, for any information, I'm going to have some of this on my website, and I've got other shows and other options of things you can look at. I've had some great shows with Ray Solano up in Austin, or Cedar Park, Texas, which is near Austin. Ray Solano is part of PD Labs and has been incredibly supportive of me over the years and my learning in integrative medicine. And would love for you guys to go to the website and check him out as well. So I will put that all down, and you can go to drpbetterlife.com and look up all these information. If you want to contact me, there is an email there on drpbetterlife.com, and I'm happy to answer emails. I ask that I can't give you strict medical information on you, but I can give generalized information, answer generalized questions. You are welcome to visit me out at my clinic. It's Pinkston Medical and Wellness Clinic. I am at Shanefield in 1604. It's 10865 Shanefield Road, Suite 1101. Our telephone number is 210-698-7825. That's also on my website. We do have a website for Pinkston Medical. It is PinkstonFamilyPracticeSA.com. And you can also visit there and get your maps and directions and all of that, and our number, or after hours if needed. And I do invite you guys to come see me. I do see cash patients and I do see insurance. We have a very valuable way of getting fantastic labs for very, very inexpensive. And it's always my idea to try to help patients. If you don't have insurance, get by that, because everybody deserves great medical care. But I appreciate you guys spending time with me today on thyroid, and we will see you on the next round. Thank you.